Get started. And right on cue, there's Susie. Susie, do you want to say hello and introduce yourself?
Sure. Hello, everyone. My name is Susie Tegman. I am the SHIBA coordinator, so I help with volunteer management. It's nice to see you all and be part of this meeting today. Can everyone see my screen?
Yes.
Yes, ma'am.
All right. Thank you.
Right. Susie is our Shiba organizational coordinator. Some of you will have worked with Eve or Nick in recent memory. So she's kind of in that space where she's helping with the administrative part of volunteer management on our side and just doing an excellent job. We're so happy to have you, Susie. Um, we're going to have a couple of more formal introductions because we have a couple of new people in our team. I'm not sure Amy's able to make it today to get your appreciation for her promotion, but Millie and Callie are here. So Millie and Callie, this is your heads up that I'm going to ask you to introduce yourselves, please, out loud to people and say about what you're doing. I wrote a relatively short program this time. I often think about my favorite humorist, Mark Twain, who once said something like, sorry for a long letter, I didn't have time to write a short one. So it's a relatively short program because it's January. And so we're like on the other side of Medicare open enrollment, embracing Medicare Advantage open enrollment. But I really want to reserve a lot of time to hear from you about your experience of open enrollment and also to hear your responses to kind of our planned work for the year ahead. So can we go ahead to the next slide, Susie? Okay, so I am Tim Smolin. I am your SHIBA program manager. Um, I, as I said, I look forward to these meetings very much, and my first purpose is always for you to hear very directly from me how much I appreciate you. It's completely sincere, and my personal relationship with you is very important to me. So if we haven't met yet, I'm looking forward to meeting you. I try to get out and be with the volunteers as much as I can. So please invite me and your RTC team to come and visit when you're celebrating or just solving something or doing some planning. But um, I, I always say at these programs that I really want you to feel free to reach out to me directly. I'm better with email than I am with phone calls, but you can write me or text me or call me. Um, it's meaning no disrespect and not to dishonor the work of the volunteer coordinators or the RTCs or the supervisors, but I want you to know that we can have like an unmediated relationship. I want to hear from you what's working and what's not working and have your feedback about my performance and the feedback about our team and your suggestions about how to make things better. So it's sincerely an invitation to please reach out if there's anything I can do. I want this to be your very favorite and most rewarding volunteer opportunity because I know many of you do multiple things. And can we go ahead, please? So here is pretty well the agenda for today that the slides are organized around. We'll have a couple of introductions. I'm going to provide a quick update about some staffing updates in our team. I want to talk about, from my perspective, what 2025 was like and focus, of course, on Medicare open enrollment. I say publicly that we do about half of all of our work of beneficiary counseling during the Medicare open enrollment period. The early data are it's actually 43% for those of you who are precise and like data and figures, but essentially that's our peak workload, right? And so it's a kind of a stress test for us and an opportunity to get kind of a baseline about how we're doing. And then, of course, I'm going to talk about 2026 and um, for me, it's pretty much business as usual. We have a good, sound, long-term plan, and we're just moving through kind of executing it. But we do have a couple of things that are going to be interesting and different and new. So I want to just highlight those, and then we'll obviously talk some more about them as we move through. And then, of course, many of you are want to forecast the future, and so I'll do a little bit of future forecasting with you. Um, and we're going to try not to, uh, what's the expression we use? Get out over our skis, right, Linda? But we're going to not outdrive our headlights or whatever expression you like, outkick your coverage if you're a football fan. So we're trying to look ahead, but we have a little bit of humility about what comes next, right? And then ample time for questions and answers. Can we go ahead, please? Mm. All right, so let me please introduce Callie and Millie to you. And either whoever would like to be first, will you just hop on screen and introduce yourself, please?
I can go first. Oh, okay. Hi, my name's Callie Curtis, and I am a new Medicare complaints coordinator. So I just started a couple months ago, but I work on some of the complex cases that need a little bit higher level of assistance. And I just moved to Olympia, and I'm very happy to be here and assist with anything I can help you all with. And I also wanted to just say thank you so much for being volunteers with us because you make such a big difference with the beneficiaries, and I really appreciate you.
Thank you.
Thank you, Callie. I saw her earlier today. My name is Millie. I'm also new to the team. I'm with SHIBA Hotline. Um, I think we're missing Paris here.
We
No?
can absolutely have Paris introduce herself. And apologies,
Um,
Paris, if I missed you on the slide.
um, I am I am also new to Olympia, and I'm learning so much about Medicare. It's like every day I'm learning something new. I'm loving it. A lot of information, but it's really all about helping our Washington residents, and I'm looking forward learning more more information and more ways to help our Washington residents.
Excellent. And Paris, apologies if I missed you. Would you like to say hello and introduce yourself?
I can say hi. I was a part of the last town hall introduction, so thank you. But I do just want to say thank you very, very much so to the volunteers. You guys are amazing. Really don't know what we would do without you guys. So thank you again for everything that you guys do. A lot of times when we get calls for folks that have used the program before, they have nothing but wonderful things to say about you guys. So thank you.
Thank you. I appreciate that. And as I said, Amy is not with us this afternoon. She's helping take care of her mom a little bit. And but we did do a couple of reorganizations in our team, which is really about growing our team bigger. For those of you who have been working with us for a while, you know that we were uh, the complement of staff was pretty consistent for a number of years, and we've been working on growing it bigger. So we had some small increases in the first couple of years that I was here, but with the advent of Commissioner Kuderer coming in January 2025, we formally added 6 positions to our organizational chart. And we have, this is a little bit inside baseball, but we have a decision package. So we have a funding request to the legislature for 6 more people for this cycle. And I'm working on the draft for 6 more for the next leg session. So in short order, we're going to, grow our team substantially. And so this is about trying to continue to manage, being responsive to you and obviously Medicare beneficiaries, the folks like Celeste that we contract with, and also of course our community partners and our funding partners in the federal government and the state government. Okay, so can we go ahead to the next slide? So here's my weird looking, trying to be a pyramid, but trying to fit it all on the screen. Um, this is sort of how I think about the shape of our work, and if you can imagine, like a before after picture, right? So um, we have about 1.6 million Medicare beneficiaries in Washington State, growing all the time. We have about, you're going to see in the data I have for you, about 221 volunteers that recorded at least one beneficiary contact record during the last Medicare open enrollment period. And so that's kind of the first part of the universe, right? Is that we're standing up a volunteer workforce of a little more than 200 people for a little more than 1.5 million Medicare beneficiaries. So obviously the priority is to grow the volunteer network over time. My personal goal that I'm committed to is 600. So my purpose is that we're going to grow from about the current 221 to about 600 and try to do that in, a thoughtful, intentional way, but to grow as kind of as quickly as we can, because we're not reaching as many people as we would like to reach. Um, and that represents both kind of manifest demand. We know that we had lots of people call or write to us during open enrollment that we weren't able to help, and that we redirected them back to 1-800-Medicare. And then I'm confident that there's a lot of latent demand. There's a lot of people who are not aware that there is an OIC or that there is a SHIBA program, that they can get local help. And so it's about trying to manifest that latent demand and create in the mind of the public that expectation that you will be treated with dignity and respect when you call us. So then, of course, the volunteer advisors, my affectionate expression for this is that the sponsor organizations do the care and feeding of the volunteers, and they create that great sort of social, emotional support for the volunteers, and our partners in technical skills training, and of course, our ambassadors in the community, right, and creating those strategic partnerships. So we did grow our volunteer network in 2025. We did grow our sponsor organization network. We engaged some more community partners. So we're doing a pretty good job, right, kind of on the top part of the pyramid. And so these staff investments are really to make sure that we're keeping up with being responsible partners to our sponsors, and they in turn to our volunteers, and that we're creating enough capacity for training and mentoring and complex cases and the referrals from you and from elected officials. So what I'm saying is we're trying to kind of grow the bottom of the pyramid so that it enables growing, the kind of top part of the pyramid. That's the construct that we're going for here. So that's what's behind the new hiring and the reorganization. And the point is we'll have a couple of more of those to tell you about in short order as we kind of grow the team and try to right size it to our partnerships. Can we go ahead, please, Susie? So as I said, I think 2025, very successful year. It's a lot about building capacity in our team. And I also want to acknowledge that I think we made a lot of really good progress in terms of our training and development work, including our instructor-led training, our online coursework, and then kind of engaging in other kind of ancillary programs like Lunch and Learn, and increasing the subscription in self-study by the volunteers with our partners like Justice and Aging, the Center for Medicare Advocacy, and the SHIBTA Center, for an example. So I think very good year for us. I think our reputation is improving. I just continue to hear lots of positive feedback and from more people and more quarters. So I feel like we had a very good year. Around the holidays, I sent you all a message with a group picture. Inside our team, inside our ONC team, we had a celebration with about 50 people across departments and a couple of people outside. And I just want to assure you that we all understood that we were just lifting you up. So we were just really not taking credit for your accomplishments, but celebrating the collaboration that we have with you. So I think it was a very good year, and I'm very excited about 2026 and managing my personal energy, Larry. Can we go ahead to the next slide? So as I said, Medicare open enrollment, peak workload for us. I know some people still have some STARS data to put in because I recorded these data across the weekend. So we'll have some more data that still haven't showed up yet. But we had 221 individuals. That includes staff in your organizations, volunteers, and in-kind partners that you work with, clocked more than 8,900 hours. So if you were counting as full-time equivalent people, that's more than 17, and almost 12,000 beneficiary contact records and beneficiary additional sessions. And I know there's some underreporting. I know that you actually helped more people than that. And I just want to highlight that those data are exclusive of the work of our team. So all of the people from the OAC that you see on screen or that you know from your work, these data do not include their contributions. So this is just the work that you all did. So um, obviously you all are very humble people, but I hope that you'll take a moment to appreciate that that is really a really, really big deal, and super important. And we take a lot of pride in the work that we did on outreach, including creating the Medicare Open Enrollment Jumpstart Toolkit, which was advertised and promoted and available through libraries and senior centers. So want to appreciate specifically Kendra and Rosie and Linda for their work leading the project, and our friends in the public affairs team, of course. And we're getting better at using media like social media to complement our more traditional marketing and outreach. And can we go ahead? So before I move on to 2026, let me just check in with you all, please. And how, from your perspective, how has 2025? How was the Medicare open enrollment? How about some feedback, some suggestions, some anecdotes that you want to share forward with us?
Tim, I'll make a comment. Um, One of the challenges, for me at least, was getting new people into Medicare.gov and having to go through the double, sign in and get the phone number. I used, my state phone at first to try and use it where they weren't comfortable trying to give us theirs, but then found out that it was maxed out. But if there was and I know that it's a Medicare issue, if it could be such that we had either a default code or number that we could put in there, knowing, and I understand the security protection, and I'm always assuring clients that, we're trying to protect their security. But for a lot of those individuals, particularly in their 80s and above, that don't have the confidence in the technical skills, it would be a much easier process there. But
Thank you for that. And let me introduce you to people that don't know you, Ed. This is my friend Ed DeBeck, and Ed is one of our Grace Harbor volunteers. And Ed, you have the distinction of being one of the most prolific volunteers in terms of the total number of beneficiary contact records. It's been a minute. I think I did this on Saturday morning, but I think that you had more than 200 all by yourself.
Thank you.
So that is I didn't clock your hours, but you did a lot of work. And you also were gracious enough to volunteer to be part of our video campaign. So you recorded a short video that you can watch out on our website. So thank you. Yeah, that darn multi-factor authentication and the timing of it, that was bitter. I'll tell you, there was no end of complaining among my colleagues, the ship directors, about that. And we did discuss that option that you put out there. So far, CMS has not been receptive to that, but I'm hoping that when we do our kind of enterprise review with CMS about, our feedback to them about the open enrollment, I'd really like to see if we can create a solution like what you're describing. So I appreciate that, Ed. I think that's very insightful.
Okay, thank you.
Yeah, and there's your friend Dave Aldrich, who also out Grays Harbor County, right? Dave, you are also a prolific creator of beneficiary contact records. Between you and Ed and Susie, the peninsula was well served. You take offense at me calling Hoquiam the peninsula?
No, no. I was just going to follow up on the idea that if we're really going to help people, 90% of the people don't know what they have.
Yeah.
And they start talking to me about what they have, and then I got to disown everything that they told me because it doesn't add up. And if I can get into their file at Medicare, then I can tell them what they have.
Yep.
And then I can work on the problem no matter how they might describe it. And so 99% of the work is figuring out what is it that I'm looking at. And if I can't get into their file, we're toast.
Okay.
If they don't have a card, we're toast. If they don't know that they have LIS benefits, we're toast about knowing how to help people. The huge piece that made the big difference is the fact that we could get into people's Medicare's files and work on stuff pretty quickly and be able to help people. But most folks, even if they see me every year for the last 10 years, really don't know what they have.
Okay. That's
Because,
fair.
and so it's just helpful in some kind of an argument, that we would be able to have, like we can call up Medicare using our unique ID number and have Medicare look stuff up without having to go through a permission process. It would be helpful if we could still do that same thing and gain that data for people so we could save Medicare a whole lot of trouble, everybody else a whole lot of trouble, because folks, anyway, like Ed said, we would be better off if we could do that.
Okay. That's fair. Callie, will you take a note to let's follow up with Dave and Susie about Mark's access? And I'll explain to everybody what I mean in just a second. But thanks for that, Dave. I appreciate it. It's absolutely true. People don't know about their current insurance. Hello, Heidi. Oh, and by way of introduction, I should say that's my friend Dave Aldrich. His on radio handle is Big Wave Dave, and working out of the Information and Assistance Office over in Aberdeen.
Thanks.
Yeah, good to see you, Dave. Heidi, did you want to be heard?
Yeah, the biggest problem I found was working with people who Lewis County is kind of its own little, I mean, we're so close to Olympia, but not close enough. And so there were people who were wanting to change plans. One check and see if their specialist in Olympia, because they have to go to Olympia for a specialist, was within their network. Well, the Medicare.gov limits it to 25 mile search. So I moved them to Centralia, and then it's because from Toledo, it says nothing within 50 miles. When you're out in Morton, right? Of course, there's nothing within 50 miles. So you move them to Centralia in the computer, so it thinks you're in Centralia, and then it says nothing within 35 miles. So there's not. So what basically people, we'd say, okay, this looks like the good where you want to go. It looks okay. Can't check the network. You need to call your doctor and check, or call Medicare and check about who's in network or not. But it was really frustrating for people that I couldn't search a big enough radius.
Yep. Thank you for that. That's a great feedback. I know many people on our staff had that same frustration helping people. So that I'll put that in the category of things I can pass forward to CMS. And for those of you who haven't met Heidi, Heidi is a relatively new volunteer and working out of Lewis County and our new sponsor organization, Timber River Connections. So thank you, Heidi. Nice to see you. And besides counseling, you did several different education outreach programs at the local library. So thank you for that.
Well, we tried to. The timing was not as good as we thought it would be, but the good outcome of all of that was I was able to meet extensively with the librarians, and we have some tentative plans for mapping out presentations for 2026, aiming to do one a quarter kind of a thing. So the good news is that we didn't have a lot of attendance at the 3 that we set up. We were there, we were present, and it was great to make contact with the librarians themselves, which was really nice.
Yeah. Well, with outreach and comedy, timing is everything, right? Thanks, Heidi. Hi, Gail. You're on mute there, my friend.
Mute. Okay, unmute. One of the things I found that calling Social Security, I mean, people have spent, hours on it. And they get very frustrated, and it frustrates me, frustrates everyone. Do we see any solution to that problem coming up?
No, I
No.
think it gets worse.
Oh dear. Okay.
Let
That's
me
not
not
helpful.
let me not sugarcoat this for you, Gail. I think it gets worse, and and I've had that experience as well. And yeah, it's bad. I think it gets worse. Honestly, I'm sorry to say it. The reason I think it gets worse is because we're going to continue to see, dislocation of people from their jobs at Social Security, and the
Okay.
technology. Right? They also have their own version of multi-factor authentication now, and I, I mean, personally, I helped many people just to navigate right where they're holding their ID up in front of the camera so they can actually talk to somebody. So I don't think it gets better, unfortunately.
So this is
Making an
Lisa,
appointment.
Jefferson County, and
And yeah, and I don't see them opening local offices again anytime soon either.
so this is, and I just want to say that I tried the National Social Security for personal and for clients. And when I went to the Port Angeles office, they were superb. Once I was on hold for 45 minutes, which was a long time, better than 3 hours nationally. But this morning I happened to call, I had to call for a reason, and I actually was helped before I got through the prompts. So there might not be local offices across the state, but I would encourage people to try the local offices where you can and not go to national if you can avoid that.
Thanks, Lisa. And will you just tell people where your local office is, please?
It's in Port Townsend.
Yep.
Well, and so the local office is in Port Angeles.
Thank you.
And I bet they would help anybody that wasn't in Port Angeles. They don't ask me what my address is.
That surprises me because I've heard the opposite several times.
Oh, they've never asked me where I was.
Okay, that's
Yeah.
great to know.
Yeah.
Okay, you can put it in your sat nav, navigate over to the Social Security office in PA, and they'll see you in short order. No, I'm
This
not
is
actually
Kelly.
suggesting
I have a
seriously.
little bit of feedback on the toolkits.
Yeah, please.
Um, they were very well received. I think that people found them very approachable. Um, they're kind of, written to help guide them through. As long as they're technically savvy, I found that, frankly, if they're not technically savvy, nobody wants me or the toolkits to tell them how to use Plan Finder. Just walk them through it. But it's still good to have that info in there. What surprised us this open enrollment was how many people at our presentations were completely new to Medicare. And so what I found is that, we brought the toolkits with us, but I missed the regular folders in terms of there are some pages, some handouts that I really like them to have, like the one that shows the two different pathways. You can take original Medicare pathway, you can do that, that one, looking at the difference between Medigaps and Medicare Advantage plans, all of those things that we have in our new to Medicare packets is still needed at our presentations. And so that was the one catch that I found when I was handing out the toolkits, is thinking, oh, darn it, if they're new, they really need some of these other things. So just some
excellent
feedback there. It'd be neat if we could incorporate those somehow into the ongoing toolkits and just go with those. Just
That
a
is
thought.
excellent. Thank you. And do you want to introduce yourself, Kelly, please?
Sure. I am the volunteer coordinator for Senior Services for South Sound, based out of the Olympia office. We help folks in Thurston and Mason counties.
Mm-hmm.
And also just in general, I found this, I've only had 2 open enrollments now, so I could compare this year to last year. This year was much more manageable. Maybe because we didn't have companies switching, changing from entire counties, but also Kaiser and their stupid letter, which made no sense to anybody, was written in legalese. Even though that was a bad point, I think in a way it was also a good point, because I think it stretched out the open enrollment. It got people contacting us earlier. So maybe that helped. Just a thought.
Yeah, I got a lot of feedback about that letter, including from Bill Hall in your group, and from
Yep.
Kaiser. And I would say Kaiser was a good partner on the other side of the letter, but yeah, that letter
Yeah,
was super disruptive, and that was
it
almost
was.
50,000 people statewide got that letter, so it was
Oh,
very
isn't that
very
wild?
disruptive in the beginning.
And
Um,
just on a Paul Harvey rest of the story thing, Bill ran across Kaiser's Medicare person and had a long conversation with him. I'll let him tell you about, but
he sent me a note.
maybe. Oh, did he? Okay, good, good, good. Yeah, maybe we can bring them on board and like we did with Mason County. It was wonderful that Mason General Hospital sent us their
Mhm.
letter before sending it to everybody. Maybe Kaiser can do that someday. We'll see.
Well, yeah, there's a lot of good suggestions baked in there, Kelly. So I think for us for the year ahead, I typically have kind of informal conversations with the plan reps. And I think what I want to do next year is organize a program where they actually come and just talk to all of us about what they're doing for next year, and invite you all to that conversation as much as you
Sounds
want.
great. Yeah.
Um, the letter is, prescribed by CMS, so they don't have any discretion about that. But then, they kind of try to follow up a lot with that. But no, that's a great suggestion. Back to the toolkit, I would love to explore that with you some more.
Excellent.
I'm
Okay.
hearing that you might like to just have us create, maybe amend our current version of the two paths and the
Mhm.
compare plans and kind of give them the same look and feel treatment, and then we can just shove them in the packet and you can keep using it.
Yeah. Yeah, I like that idea a lot.
Okay. So let's you and me and Linda is your RTC. We can talk about that because I think that's a very easy amendment for us to make. And that makes sense to me, right? That's kind of one of the phenomenons about open enrollment is it's when everybody starts paying attention. So the folks who work on the hotline will say we just get tons of calls that say, "Well, I'm retiring in June next year," and I'm like, "Well, that's great. Call us in February." Right now, someone's losing their
Yes.
plane in 2 weeks.
Yes.
So, but it does kind of like galvanize people's attention, right?
That's that
So
point.
that's a super edit. David Sharp, what do you have for us? And then Monica, you're next.
Well, I was just going to kind of say what you just said is that I think our schedulers who work for Island Senior Resources here um, may have been able to help us more. And I put in this suggestion, but I don't know that we got it implemented this year, that anybody who's calling that is new to Medicare, it'd probably be good to get their birth month from them and then put them on a list that we can call them in January and let them know that we're swamped right now with people that need to change plans. But they have a certain window of time that they can enroll. They don't need to do it right away. And if they can hold off and wait till January, we'll better be able to serve them. And that frees up a lot more appointments for us. We did have that as well. A lot of new to Medicare folks. And I felt like, folks that are coming in 6 months ahead of time are, that's great. I was one of those that went in and saw a vice chief counselor 6 months ahead of time. But during open enrollment, that's just kind of counterproductive and not a good use of our time. So
Great.
I think that we could screen those and put them on a list that we can all start calling come January and try to help them out then.
Okay, so don't let me put words in your mouth, David, but are you asking for us, like folks like Millie and Paris, Aaron, that are on the phone to do that screening and not refer, but like put them on a separate call sheet?
I'm not officially asking anything, and just to throw it out as a suggestion. I was thinking more about our own, the folks that do our appointments for us at
Sure.
Island Resources.
Okay.
That if they screen them and say, hey, look, do you mind waiting until January? You've got plenty of time. It would take a little bit of education for them about initial enrollment period and that sort of thing.
Yep.
But I think that's in their scope to be able to talk to folks and say, hey, look, if your birthday's in June, you can easily wait till January to get that information. There's no need to do it right now. And reassure them that open enrollment does not apply to the new to Medicare folks. I think that's the trouble is people that are just coming up on it hear that we're in open enrollment and it's like, oh my God, I have to do something. I need to do that now because I'm
Yep.
eligible next year.
Yep.
So I think being able to reassure them and let them know you don't need an appointment now would be great.
Okay. That's super helpful, David.
Mhm.
Appreciate it. Hey, Monica, and then we'll do Connie.
Sure. Actually, my message is really for Kelly. Kelly, I create a Welcome to Medicare folder packet for our new to Medicare beneficiaries. And a lot of the items that are in that toolkit folder is what I use, and I just print them. I either get copies from the OIC website and either request that you get printed copies or I print them in-house and I create my own folders. So I'd be happy to share with what I put in those to give out to our beneficiaries,
We
and I can
do the
send you an email
same.
on that.
Thank you so much, Monica. We do the same thing. It's just that during open enrollment, I was using the toolkits rather than the usual folders. And I was thinking it would be pretty cool if our toolkits could kind of serve both functions,
Yeah.
rather than going back to our old folders, which frankly didn't excite people. It didn't get them turned on much about it, but I felt like they responded better to the toolkit ones.
They're
Yeah.
fun images. There were fun
Yeah.
little images on there.
Yeah, but
One little
unlike
feedback.
you, we had, we have folders that we normally bring to new to Medicare presentations, and we've over time, put in different handouts that we really like. Yeah, just
Perfect.
wanted to
Okay, so you're
incorporate
already
both.
doing
Yeah.
that. Good,
Yeah,
good.
thank you so much.
Of course, yeah. One thing that feedback that I've gotten from the public is I didn't get much. I'm the volunteer coordinator for Spokane and Whitman County. Did not receive much feedback for the local area other than from our partnerships, from our county libraries. They absolutely loved them. They thought it was great. We refilled several locations several times. So timing was a little bit difficult for us just because we're out in the field doing things and then refilling those packets. But I was able to have volunteers able to send those out to the field. I did get one reply back from a person that we assisted in Whitman County. It's very rural. They all had their packets with them. It was a library. And we had about 15 people waiting for us with 3 volunteers and about a 2-hour time window to get through all of them. So we had to stay later than anticipated, but it was worth it. But she said her feedback was people have to read. And I didn't want to take the time to read it. So until I sat down to read it, then it all made sense to me. But her first impression was you have to read. And it felt overwhelming. It was too much information to read. So and she's not wrong. I would think, there's a lot of people that we get that with the letters, that they got letters from insurance companies. They don't read the whole thing. So that's just the public of what it does. They don't read.
Mm-hmm. Okay, that's all very helpful, Monica. Thank you. Appreciate it. Thank you. Hey, Connie, what do you have for us?
2 things. First of all, we do a lot of presentations, and the OEP, the new format OEP presentation was fantastic.
Thank you for that.
And I wasn't going to like it. I'm old. I don't like new. But after I looked at it and delivered a few, it's like, no, this is cleaner. This is so much cleaner. So my big request for y'all is to do the same thing for Welcome to Medicare. Yes, I'll be delighted to help. By the way, whoever is working on those, I cannot remember the names right now, but they solicited my input on the presentation and actually made changes based on what we told them after the actual presentations were made, which really was, I think, of course, it was made it better, but it also made me feel terrific. Secondly, we desperately need to screen requests for presentations better. We have to give people tools. So when they're talking to the people that want to book a presentation, we had several requests and actually were accepted and showed up, and they did not want a standard 2-hour presentation. They wanted different stuff. And so we can do those, but we need to know ahead of time. But also, to a previous comment, the people booking these simply do not understand the difference between OEP and welcome to Medicare. They do not.
Mm.
And it's kind of simple. Just say, hey, please screen your folks if you're making your reservations. If you have your own reservation system, please screen people. If they are new to Medicare, then they need to go this route. If they are already enrolled in Medicare, this is the presentation for them, because it's very difficult to try and, especially on the fly, deal with both at the same time. It is extremely difficult. And I think we need, Caroline does a fabulous job for Solid Ground and King County, but I think we need to give her some better tools to help with that. And if it means us as presenters talking to whoever it is, I'm okay with that. So that's kind of my 4 bits. And also just ad hoc presentations. We got involved with the senior resource council for Kirkland, and it turned out to be a really nice presentation, but holy cow, was that a nightmare, because they did not, what they wanted was like a kind of a question and answer stuff, and we don't really have a presentation set up for that, and we can't just go presenting stuff off the top of our heads. So we learned how to do that.
Okay.
But a lot of ad hoc stuff is being requested. Okay.
Yep.
And thank you all
That's
for
all very
terrific
helpful, Connie.
support.
I appreciate it.
Yep.
I think we can support you with a bunch of those things for sure. And I agree with you. Caroline's doing a terrific job, and she needs some more help. She's got Alex, but a little more help is good. Yep. And Connie, do you want to introduce yourself to people who don't know you, please?
Oh, sure. Is there anyone? I'm Connie Taylor, and I am a Royal Pain. I'm the titular Royal Pain for King County.
Not for me, but I appreciate your sensitivity.
Self-described.
Self-described. Dave Aldrich, you're back, my friend.
I was going to mention, I've been doing this Medicare open enrollment period since 2006. And this is the first year people were actually, anxiety was part of what people expressed regarding being able to continue to get help.
Yep.
Because
I want to talk about that in my future forecast for sure. But yes, no, I heard that a bunch from volunteers and from beneficiaries even. Yep.
It wasn't just me. It was unique this year that people were scared, Navy language, that they weren't going to continue to get help because they're realizing they're getting older. And I hear about people don't comprehend what it is that's happening to them, even if, anyway, it's difficult. We can help them. I'm happy that we're here, but if we weren't here, there'd be a lot of trouble for them.
Absolutely true.
And they realized it this year, and I've had people that I've helped for like 12 or 13 years expressed that to me this year, and it carried on with most everybody that came in.
Yeah, I think you're right. I mean that my experience out in the field really resonates with that, and I sent some data over to you and the other volunteer coordinators, and we have a question that you fill out on STARS about how did you hear about us, and far and away the number of responses: prior help, prior customer, got help in the past, which is great. And I think you're right. The tenor of the conversations really shifted this year because of all the dark news that's coming out of Washington, D.C.
I ascribe it quite a bit to that, but they realize how vulnerable they are, and they don't have the tools to fix it.
It's really real. It's really real. Yeah, and I think the reality is they are vulnerable. So I mean, I think we shouldn't try to deflect that. They are vulnerable, and we are here to help support them. And and again, we talk about this at all of these kind of get-togethers, and when I meet with you all in small groups. But for me, the priority for us is finding those really vulnerable people, because it's the biggest impact, and they're the least likely to find somebody else to help them. Hey, David, what do you have for us?
Oh, sorry to come back in with this,
but
always talk about fear of changes. I'm wondering how much we're going to get questions thrown at us about the ACA premiums going up so high.
I think you're going to get a bunch of that.
Yeah, and I'm wondering, is there any information coming out from OIC that we can share with clients.
Not
I haven't
yet.
had any of
I'm
those
kind
calls
of
yet,
keeping my powder dry, so to speak, but I'm working on.
okay.
I'm ready for that. Yes.
Yeah, I know we're Medicare focused, but the state health insurance benefits advisors doesn't really say Medicare.
Right.
So I think we're going to get a lot of folks asking those questions, and I don't know what to tell them.
I think you will, and I'm going to help you with some talking points. I would say I was in Seattle yesterday talking to some colleagues, and I think that what we're going to get is a policy solution that's going to take a while to implement, right? I mean, honestly, there is just an administrative aspect of this that is really real. So I'll say
Yeah.
the insurance commissioner's office, even though these are the ACA plans, the health benefits exchange, Obamacare, however you call it, we do approve the rates for those plans that are sold in Washington State, right? And so, anticipating the possibility of the subsidies, so by subsidies I mean the enhanced premium tax credits, being eliminated, we asked the company to file two sets of rates, kind of like one status quo and one absent subsidies. So we have those rates approved either direction, right? But if elected people, if the Congress and the president sign off on an intermediate space, right, where they continue subsidies for some people but not for others, we're going to have to go back to the plans and ask them to file new rates and review those and approve those. And so even if there is a policy solution, which is not happening in the next few weeks, when it does come, there's going to be a delay administratively, right? So realistically, you're not asking me, but if you were asking me, best case, we're looking at like this happens mid-year. And
Okay.
there's a real possibility that there is no relief, right? I mean, that we just go forward without the subsidies. So I'm just saying that it's going to be a challenge, and you don't have something for me for talking points because I'm not sure where we're going to land yet.
Yeah, I'm just concerned that it's going to, having been an ER nurse for a long time, I think people are going to get out of their insurance plans. They're going to go to ERs, overload the ERs even more than they already are, and then just ask for charity care because they can't afford to pay the bill.
All my friends that are rural hospital administrators, that's their nightmare.
Yeah.
Yeah. Yeah. It's real. I mean, it's really real.
Yeah, it's going to put hospitals under.
We hope not. But yeah, big changes on the horizon, especially for rural hospitals. It's going to be a very tough year.
Yeah.
Yep.
Okay, thanks.
Hey, Ed, of course. Happy to. That's why I love these conversations. What do you have for us, Ed?
Well, there are only, I think, 7 hospitals in Washington out of the 85 that are in the black.
Okay.
So, but mine is more of, being out here in the rural plains of the Pacific coast, is on some of the book work in regard to how many attempts I give. When I try to make an attempt for a client, I give them 3 chances.
Yep.
So I'll call and I try to vary the times a day that I'll call. And then if not, then they're done.
Yep.
And I guess my question is that fair? Or
yes.
What's the recommendation? And then the second part of that question is on entering statistics. And I know for stars that you don't want to put in data in regard to people that you didn't really contact. But from my perspective, and maybe this is from my pre-retirement life, is I don't want somebody to call in and say, Ed didn't give me a call.
Right.
But then I have the record that says, hey, we made 3 attempts and it was on this day at this time. So just your thoughts on, what for that bookkeeping piece of it.
Yeah, you and in your pre-retirement life, you were operations director for Safeway. So we're talking about logistical conversation here. Yeah. And my friend Rosie is not on screen, but she's smiling because she asked me if I would talk about this today, and I said no, I don't want to. So so she's smiling in the background because you're going to make me talk about it. So yes, so in general, what our federal funding partners want for STARS records is like a substantial contact. Like they want there to be some work done, right? So I told Rosie, like, I don't want to just scold everybody publicly, talk about this, get into the details, but we have a bunch of stars records that are 2, 3, 4, 5 minutes, because the volunteers are doing what you suggested. They want there to be a record that there was an attempt or they answered a simple question, right? But we don't have a good way, and we're hoping to put this in place. We don't have a good way, even on our side, of capturing all of that kind of transactional stuff that we do with clients, right? So again, I'll say Millie's on the phone, Aaron's on the phone all day long. Could you please send me the most current rate chart? Could you please send me this publication? They're all meaningful contacts, but they're not material in the stars way. And we're leaking all of those data, right? And so I don't have a good productive answer for you, Ed, about that. In terms of contacts, 3 to me is more than enough. I think if I look across 17 sponsor organizations, that's sort of the standard practice is 3 attempts, various times, text, email, phone call. For me, if I'm calling you, I leave a message and I move on. Now, you're being more generous, which I appreciate, but I'll just say, in spite of that, what happens is now the person you've been trying to reach, Philip, is going to call me on the day after your 3rd attempt and say, how come no one ever called me back? And I'm going to say, do you have your voicemail set up? Did you check it? Can you look at your recent calls and see that Ed called you 4 times, right? But the presentation is, how come I'm waiting for a call? So we're never going to defeat that altogether. And honestly, we don't want them answering anonymous calls, right? We want them to screen their calls, but we're still, again, like we're missing some contacts there. So I would say, don't let go of 3 attempts. Don't change what you're doing about stars. And yeah, and Linda and all the RTCs are going to have some suggestions about stars record keeping in the year ahead.
Well, and I guess from the volunteers' perspective is we've put time in that to enter
right.
it. So even making the attempt takes time. So
yes. And now I'm going to go even further where I don't want to go, that Rosie wants to take me, which is that there is literally like a timesheet record in stars that we want you all to use because you're all underreporting your time. So even when you're doing a BCR, count your research, count your callback, count your consultation with another volunteer about what the right thing to do is. It all goes on that individual's BCR, but then there's a separate timesheet where you can record all the other work that you're doing. And, for some of your organizations, that's very meaningful because they report it back as like matching dollars, right? And community engagement. But I'm just saying, my purpose in life today is just to say, you guys are doing great. I'm super grateful. There's some things we can do better, but the headline is you're doing great. So I don't want to go too far into giving you notes about what to do better that you lose track of that. I appreciate you.
Great. All right.
Is that helpful?
Yes, very much. Thanks.
Hey, Monica, and then Celeste, I'm coming to you. I saw you waving.
Yeah, so our volunteers do the same thing. We do a 3 calls as well, but we have a master spreadsheet. So if a volunteer is not able to reach a client, they email us back and say what made the 3 attempts wasn't able to make contact. Then we put a note on that master dashboard saying that attempted 3 times was not able. Because I have had in the past clients complain saying that we haven't called and we did try and their voicemail was full or they weren't able to leave it, whatever. But that is my solution to that, is that we've tried and then we just show record on our end that we keep record of it.
Yep.
And I did a little analysis for open enrollment on how many calls and emails, all of the referrals that we received, and then compared to how many BCRs there were. And there is so many that we received, but we weren't able to reach them. So, and that's just the way it is right now, because we tell people don't answer the phone, and they just don't, or, whatever reasoning. But there's a lot more calls that we get than how many we served. That's for sure. I did an analysis of the last 3 years, and that piece has increased. Our call time that we're counseling has increased for about 15-20 minutes as we're getting new volunteers, and the calls are just getting more complex.
Yes.
That's taking more time to counsel. So I've noticed that in the past 3 years as well.
And again, our experience would validate that. We're pushing on an average call time now of 50 minutes. Now, when I say average, I mean, I'm including all of those ones that you guys put in 3 minutes. I'm still getting to 50 on average, right? So you're doing a lot of 90-minute phone calls.
Yeah, absolutely. It's about my numbers are too. Yeah.
Yep. Which is all good, right? It's all good. And more follow-up calls, right? The number of additional sessions is increasing as well. Yep, because it's just too much for someone in one session. Yep. Hey, Celeste, nice to see you. What do you have for us?
Oh, am I okay?
It's your turn. Happy New Year. How's your mom?
We do a daily grid where whenever any kind of contact is attempted, we make a note, date with the note, often with the time. And I save those in the morning and I save them at the end of the day, every day. And then I make it accessible for all of the advisors as well. So it is a lot of work, but it's good because we're able to go back 2 months ago if somebody calls and says, oh, blah, blah, blah. So we can go back and look at those. But what I was going to originally bring up is that we do 3 attempts. However, and other people probably, other counties do the same. If they return a call, that starts the clock over again. So if they get back so then we'll try 3 times again. And because if they're making that effort, that if there is that communication that's being attempted, but it's people not picking up the phone or I don't recognize your number or whatever, but we've always started the clock over again if they return a call.
Fair.
So
That's
that's
very
what we do.
generous. Yep. And again, I say this every time we get together, but I think it just bears repeating that I'm very comfortable with 17 different solutions across 17 different sponsors. So I'm not asking you all to conform to one model or do things the same way. I don't think of this as requiring standard work, but it's nice for you all to learn from each other about what you're doing, right? And kind of borrow, but I'm not asking you all to kind of come into one uniform way of doing things because I don't think that's the best solution. But I like the conversation. Okay, last call before I move on to 2026, and then we'll do questions over again. Still, anytime, and raise your hand or drop a note in the chat or interrupt me. But here's a quick review about what we've got for 2026. So for me, it's about 4. These are obviously very broad priorities, but we have enough diverse, proficient volunteer advisors. And then so people ask me, like, what's enough? And I say, well, okay, so the beginning place for me is that we have enough volunteers that when open enrollment comes, we can direct all the calls out to the field, right? So where we were at this year was we were not close to that, right? So individually, I would hear back from Carol Ann, or I would hear back from Monica, or I'd hear back from Celeste, like, we can't take any more referrals now for a week or a couple of weeks or until you hear back from me. And that happened kind of universally across our network. So that to me says, I don't yet have enough volunteers in place because I can't refer all the work out to the field, right? So at a high level, enough means that we're taking care of that manifest demand, right? And then the next step in enough is like, I'm sort of self-regulating our marketing so that I don't overwhelm you, right? So I have a sense of how much work Larry can do and all the 221 Larrys. And so when we put together the Jumpstart Toolkit, I did not publish our phone number because I can't take any more phone calls, right? So after we solve kind of the first enough, then the next enough is that I can take my foot off the brake in terms of marketing the program, right? Because I'm confident there's enough capacity that I can do a bit more advertising and outreach, right? So enough is moving towards like 600, right, for me. And we can talk about diverse all day long. My very favorite thing to talk about. Proficient for me is what we're going to do a bunch of work on, and Tamara's on the call today. We're going to try to stand up. You guys are already doing this, but to create a little bit more support for the work you're doing on mentoring and peer coaching, right? So that we have a more shared understanding And I'm just picking on Larry because he's beloved to me. And we were just working on a case a couple of days ago. So proficient means that if Larry counsels you and I counsel you, it's not wildly different. There's more or less like the same consultation. We're starting with an idea about a complete effective consultation included these things, right? And the client experience of it was kind of like this. So for us, it's about creating that sort of standard definition of what proficiency is, training towards it, and then assessing performance, right? So that we kind of take that affirmative next step. So not just like I talked to Larry for 15 minutes at the pizza party, and then I walk away thinking, I have no concerns at all about Larry taking the next call. But like, you know what, Larry, let's do a role play. And I'm going to pitch you a case and I'm going to listen and I'm going to observe and then I'm going to assess your performance. Like now we're moving closer to where I want to be at across our network, right? So proficient broadly, that's what I mean by a proficient volunteer advisor, right? And of course, you're working in your scope of practice, right? So when someone shows up and they say, I had this dream, I don't want Larry interpreting it. I don't care that he's part of the Jungian Society of King County. That's not what you do as a SHIBA volunteer. Okay, stay in your lane, Larry. Okay, so proficient. And then outreach marketing and referrals. Obviously, a lot of work to do about technology. We got to give more support to the Celeste and Monica of the world so that they're not consumed by the administrative work of managing referrals back and forth to the volunteers, right? Because that's not the high value work. But we need to continue to do a better job. My sort of shorthand for this is like, we do a pretty good job with the people that find us, but we got to do a better job of finding the people that need us, right? So how do we continue, especially through partners, right? So how do we continue to find those people that are unlikely to reach out to us for whatever reason or even be aware that we're here? So let's stand up that really effective campaign for, I was in Yakima recently and I said, how did you manage to escape my love and affection? There shouldn't be people in the community who don't know that the SHIBA program is here to help them. So let's keep working on driving that awareness and creating the expectation that you're not going to get put on hold endlessly, that you're going to get a real person in real time. Aaron's going to answer your call, and a couple of days later, he's going to call you back and he's going to offer to meet you at the library in Bellevue. And it's going to be a positive experience. We're not going to talk down to you, right? The person's going to be relatable, kind, generous, patient. So how do we just create that expectation in the community that that's what they can expect from us in a time when trust in government is historically low, right? And people are hostile to government agencies. I think we can be kind of the countervailing positive force. Obviously, collect and present data and evidence. That's how I go to elected people and say, give me more money in a polite, effective, like bureaucratic way. And that's how we get better, right? That's how we like recycle our data and figure out what we should be training towards and where our support should be at and all of that kind of stuff, right? And then handle complex cases, including fraud and complaints. And that's the work of Philip and Callie, Diane, Anita, Samaria. At some point, there's going to be cases that we're going to handle that are not appropriate for you or that are overflow calls or that are what we call constituent referrals, elected officials. So we're going to have to reserve some capacity in our team to work some of the cases effectively, either in collaboration with you or independently. Yeah, send me success stories for sure. Right? So we say that data tells and stories sell. The most persuasive thing is stories about the clients that we helped, anecdotes. So broadly, that's kind of our work as a SHIBA program from my perspective in the year ahead. Can we go one more slide, Susie? So how about first quarter? We're in the first quarter. We're a few days into the first quarter. So priority for us, obviously, grow the network. So we're going to do a volunteer recruitment campaign. We do this every year in the winter. And the kind of the centerpiece of that is what we call a direct mail approach. It doesn't make sense to me that this works, but this actually works. Some of you, we recruited you like this. So we just buy a mailing list. And I say, I want all the zip codes in these 20 zip codes in Pierce County, everybody who's between 60 and 70 years old, household income less than $200,000, and I'm going to ship 50,000 pieces of mail, and then people are going to start calling Tammy and saying, I want to be a SHIBA volunteer with Sound Outreach. I don't know why that works, but that works. So we're going to do that campaign. And then we'll have social media, radio advertising, other things to kind of surround that. What comes next is then kind of what I call screening interview, right? So a Celeste or a Monica or a Kelly is going to have a conversation to figure out if it's a good fit. And then we do a criminal background check. And then we enroll them into basic training and CE training. And then 20 years later, I have Larry. And then, of course, we're counting on you and all of our partners to help with outreach and engagement as well, right? So kind of each one reach one, right? If you're having a great experience as a volunteer, please help us recruit more people, right? We need like a farm system. We need a pipeline because, Larry has a shelf life. And so at some point, Larry's not going to be here and there's going to be like a legacy appointment. Someone's going to take over that Larry helped mentor. So we got to, enough also relates to a sustainable plan, right? A system of replacing our volunteers as they move on, right? So that's our priority for first quarter, right? Is that volunteer recruitment campaign. And then can we go ahead, please, Susie? Okay, then some projects that are first quarter work for us. We talked a little bit about mentoring with tremendous support and leadership from Elena Garrison. We have now a really good kind of online self-paced learning management system through the Canvas system in cooperation with WSU. Kim McKenna is our senior Medicare Patrol coordinator. So we're going to do some more work on integrating the SMP work into our SHIP work, including basic training, continuing education training, outreach and education, and as I said, more hiring. So we just have a bunch of hiring to do. I'm excited about it, but we're going to have a bunch more people to introduce you to by the time we roll around to like the April town hall meeting. So that's kind of, in terms of our team, that's going to be the focus of our project work. And can we go ahead, Susie? So what's new? Celeste can sing. I can't sing, so I'm not going to sing what's new. I haven't seen you in a while as much as I want to. I'm going to restrain myself. So what's new is the WA Cares Fund and supplemental long-term care insurance policies. So I'm going to do a lot more work with you all about this. Paris is going to help me. So WA Cares means specific to Washington State, kind of unique experiment, payroll taxed by me to pre-fund benefits for me to the tune of about $36,000 later in life that I can use to pay for long-term care services and supports, including in-home care services. We're going to create a market then. We just had our final rules hearing today. The OIC is now going to admit companies to sell a supplemental long-term care insurance policy. So it's a private policy that kind of comes alongside of your WA Cares benefit. And there was a bill that the legislature passed and the governor signs, and it actually directs the SHIBA program to create a consumer's guide to supplemental long-term care insurance and kind of activate our volunteer network and recruit new volunteers to help counsel people about supplemental long-term care insurance and traditional long-term care insurance policies. So I'm going to be working to stand up a couple of work groups, create this publication, hire a position for this role, and then come back out to you all and say, how is your appetite for learning your way into providing some counseling and consultations about this? This is a super big deal for our partners in the area agencies on aging and aging and disability resource centers. The AAA where Monica works out in Spokane and the AAA here in Olympia, Lewis Mason Thurston counties are pilot projects for doing an end-to-end test of this. So I'm going to be coming back to you all for some feedback about how we can help create awareness about the project in the place that I live and the place that Monica lives. And then we should be, right, fingers crossed, actually paying benefits through the WA Cares Fund starting in July. So we're kind of on this kind of 6-month clock to get this stood up. By me, I mean my friends at DSHS, but we're going to support them with that. And I'm going to be coming to you from support here in the first quarter or so. So more about this, a lot more about this soon. And can we go ahead, Susie? Okay, future forecast. As Dave Aldrich said, lots of questions about funding for the SHIBA program. Funding for the SHIBA program is secure. So please, you feel reassured, and please reassure your partners and your clients. There's just a lot of mischief happening in DC, and there's going to be a lot of drama. But at the end of the day, the funding for the SHIBA program is secure. And by that, I mean all three grant sources. I'm confident it's not increasing, but I'm confident it's not going away. I'm confident that there'll be increased state support for the SHIBA program. The program has a great reputation, and all the credit to you for that. And the commissioner is a big fan of the SHIBA program. So we have lots of institutional support. We have lots of support in the legislature and in the community. So the funding for our program is going to continue to increase. So we're going to try to continue to, as I say, request more funding, both for staffing, for payments for contractors, support for the volunteers, and expanding our network. So the funding for the program is secure. So have some confidence in that. As I said in our program in October, the state budget forecast is tough. So the legislature is going to come back next week. It's a short session, and I'm confident we're going to see spending reductions, cuts in programs, reduced staffing, as well as all the other things that happen when the state is trying to economize. So I just, this is like a PG rated conversation. I'm acknowledging that when those things happen, it has real life impacts on our clients, right? Because they can't reach the HCA, they can't reach the SHS. They have inexperienced people taking the place of experienced people. And the uncertainty that it creates just slows everything down. So I'm just acknowledging that although we're not directly impacted by that, we and you are indirectly affected by that. And we're going to be swimming in that water for a couple of cycles, unfortunately. So on the state side, it's tough. I'll just say that. 2026 is kind of a liminal year for the changes that came out of HR1. I don't prefer to call it the big, beautiful bill. That's not my personal assessment of that. But this is the year where the state is going to be negotiating with the federal government about the changes in Medicaid that you've heard about. So things like recertifications and work requirements. All of that stuff we're working out this year. We did, as you know, implement changes in Medicare eligibility for new people who are not citizens. Starting in January, we start taking away people's eligibility. So 2026 is the year of lots of outreach to make sure that new people and continuing people are aware of the changes in eligibility for non-citizens. And we are almost for sure going to go from annual to twice a year recertifications. And so we're going to essentially see like a doubling of the support when people get these confusing, threatening, frustrating letters. That's going to start happening again. So, for a lot of our clients, it's going to feel like whiplash in the sense that we went for 3 years without recertifying, and then we jumped back into it, and now we're accelerating it to twice a year. And this is the design decision. This is about separating people from their benefits. And so it's our job to make sure that that stays intact. And that's going to be super effortful, especially for people who don't have English, right? Or as Kelly said, people don't read. So we have a lot of work to do about helping keep our low-income people connected to their benefits, whether that's Apple Health or the ACA plans or Medicare, because they're all going to show up. And I want them all to show up. And then there are some rules changes for Medicare. I don't want to go into the excruciating details today, but I will have more for you soon. But I have heard from you and lots of other people questions about this thing called WISER. And some of you will be aware that Senator Murray and Senator Cantwell and some others have sponsored a bill to not have WISER go forward. Tons of respect for Senator Murray and Senator Cantwell. That bill's not going to get a hearing. WISER is going forward. And so I promised Larry the last time we had lunch together that I'll produce some kind of talking points for you guys. On our side, we will be tracking complaints. So again, I'm talking about Diane and Callie, Philip, Samaria, Anita, we will be tracking complaints and reporting that back to the commissioner and our elected officials about delays in care or other frustrations people have about these prior authorizations. So I'll produce some talking points for you. We'll be tracking that, and we'll try to figure out how to help you kind of memorialize that in your note taking so that we're aware of what you're hearing out in the field. And kind of anybody's guess about how big a deal it is, but it's definitely captured people's imagination. I think that's what I have, Susie. Yep. I feel hopeful personally. I was celebrating with my family in New England. I'm older than most of them, which is fine. I'm not upset about it. But somebody was playing this jazz record album by Cannonball Adderley, if anybody you know him. I'm a fan of him. And he has this record album called Country Preacher, where they were doing some fundraising for Jesse Jackson a million years ago. And I was relating to the people I was sitting with. I said, I voted for Jesse Jackson in 1984 and 1988. And they couldn't believe it. And I said, no, it's for real. I did. I'm a big fan of Jesse Jackson. So, yeah, I'm hopeful. As my old dear friend Jesse Jackson says, keep hope alive. So I remain hopeful in spite of all of these challenges. And each of you and all of you are an inspiration to me. So as I said at the start of the call, first purpose for me in these calls is just on behalf of myself and our leadership and the commissioner to say thank you. If you don't know what you do every day, it makes a meaningful difference. And I'm not really concerned about whether we did 11,000 BCRs or 111,000 BCRs, because I know that each individual person that you helped, to them, that was a life-changing thing. So very grateful. Thank you.
Jim.
What else do we have? We're at time, kind of, sadly. I used up all your time. You can't get it back. Paris, what do you have for us?
Hi, I just had a quick question. So we have been receiving calls on the hotline about the Wiser pilot program. And so I just want to confirm that folks that do have a complaint with that, they could just do their traditional complaint on our website. Okay, perfect. Thank you.
Yep. And we're going to scoop up those data out of Orca. Hey, there's Steve Pesic. Hey, Steve, how are you?
Sorry, doing well.
I'm going to be in Yakima, Toppenish, January, 13 February. I'd love to see you.
All right, sounds good.
All right.
Wait a minute, 13th of January or February?
Both.
February, I'll be gone.
Naturally.
January, I should be here.
All right. Come see me on Friday next week.
Sounds good.
All right. Good to see you. You're looking well.
Thank you. You too.
All right. 5 more minutes. Who wants to regale me with a great story?
Got no story for you, but going back to that, people don't read. I think that more importantly, people don't comprehend. Because they don't comprehend the legalese language that's written by attorneys for attorneys, they disengage and then they're not going to comprehend. And comprehension is a huge piece of the reading, because that's what we're trying to get them to comprehend what it is that now they got to put some thoughts together and then try to solve a problem. It's not going to happen.
It's hard. It's hard. It takes time, right?
Well, they don't have the language to read it by and understand it by. And so therefore, when they start reading it now at 82 years old, they're done trying to do that stuff because they can read it, but then there's no comprehension.
Yes.
And I blame the system for that. And that's one key thing that we do when we're counseling people is making that stuff into bites that they can comprehend and then they get it. But it's really hard for them to engage with a lot of the paperwork that they get.
No, I think that that's real, Dave. I always love my conversations with you, and I think that when I think about the work that we're trying to support you with, and I want to say, when I think about mentoring and peer coaching, I don't mean to imply that you guys are not doing that or it's not going great. I just want us to provide some more support for that, right, and to help it be sustainable. But you guys are doing this all the time. You mentored Ed DeBeck, and that came out great. But I think what you're describing is, there's a lot of ethical issues that go into this counseling that you do. And you really are sort of like de facto social workers. And I think that beyond being kind of technically right, there's a question about effectiveness. Are you really helping that person to exercise the agency that they have, and to help them not just with today's open enrollment but the next one, right? And to activate them to help somebody else in the community. And you're going to have to be really creative about different ways of doing that, because the same thing doesn't work for two different people, or maybe not even the same person in two different conversations. So I'm just acknowledging that I'm agreeing with you, and it's complex. And I think it's something that's underappreciated about the work that you do, but I want you to know that I see it.
Hey, thank you.
You're welcome. Hey, Connie.
On a positive note, I just want you all to know and completely understand that, first of all, the OIC has your back. Those guys are fantastic. Phil and Linda, thank you so much. Shout out to you. And the second thing to know is that if you have time to be an advocate, get on calls with people, especially where there's egregious issues with Medigap plans, Medicare Advantage plans, whatever. If you, I have had two excellent supported issues this last year, which are still taking up a lot of my time, where we have got on calls. And if you can document the bejabbers out of, I called you on this day, and we had a 40-minute call. I talked to this agent number. Here's the key features. You get on the phone, you say, "Hi, I love the work you're doing. You guys are so fantastic. I have Joe Dokes on the line here. Joe, say hello." And then, I need to talk to you. I'm with SHIBA. We're under the auspices of the Office of the Insurance Commissioner of the State of Washington. Pause. And then say, "Can you tell me your agent number?" So after you do that, you have their attention. And then don't give up. Call back and call back and call back until you get it. And you know what? You get it. And I've learned a lot about how to document this stuff. So it works. And thank you so much, especially Phil and Linda. I have one still I'm working on, but it's gonna happen. So thank you.
Of course, you're welcome.
Good
You're
job.
welcome.
Oh, and you, of course, Tim.
Oh, wow. Let's don't get carried away, but thank you. We have like a workhorse and a show horse, and you know which one I am. Okay, let me just say thank you. This was the Tuesday version of the program. You're welcome to come to the Wednesday version, the Thursday version. It's the same slide deck, but different conversation. Appreciate you being here. I think that Susie recorded the program, so we'll try to figure out how to get it posted. So if you want to go back and listen to it again, but very much appreciate you taking time out to be here today. Happy New Year, and I'm looking forward to the year ahead working with you. And Larry, thank you for letting me pick on you today.
Thanks, Tim.
Welcome. Take care, y'all. Bye, Ian.
Thanks, Tim.
Good to see you, Steve.